Renal Anatomy and Physiology, Acid-Base Physiology by Shayla High, Michael Markle, Brittany Olson. The anatomy and physiology of urine flow. What is the urinary system? The urinary system consists of 2 kidneys, 2 ureters, the bladder, and the urethra. Its main responsibility is to rid the body of metabolic waste and toxins through the production, storage, and excretion of urine. The kidney maintains homeostasis through acid-base balance and through the water-salt balance of the blood. Normally, humans produce about 2.9 liters of urine over a 24-hour period. The pathway of urine flow is nephron through the glomerulus, through the Bowman's capsule, through the proximal convoluted tubules, through the loops of Henle, through the distal convoluted tubules, through collecting ducts, through the minor calyx, major calyx, renal pelvis, ureter, bladder, urethra, the urethral orifices, and out of the body. Urinary flow. So inside the kidneys, a plasma-like fluid is filtered through the glomerular capillaries. The glomerulus is about 200 micrometers in diameter and is formed by invagination of a tuft of capillaries that flows into the dilated ends of the nephron. This is known as the Bowman's capsule. So each human kidney has approximately 1.3 million nephrons. The renal blood flow enters the glomerulus through the afferent arteriole and exits through the efferent arterioles. As the plasma continues to flow into the tubules, this is known as glomerular filtration. The glomerular membrane permits the free passage of neutral substances of a certain size through the filtration slits that are made up of the podocytes. The volume of the plasma is reduced and its composition is altered by tubular reabsorption and tubular secretion. It eventually makes up the urine that enters the renal pelvis. So what is reabsorbed during tubular reabsorption? Sodium reabsorption is extremely important because it creates the environment for water and other substances to be reabsorbed along with it. Glucose is transported along with sodium. There is usually no glucose secreted in urine. The amount of water reabsorbed is continually being regulated by hormones. Hydration plays a key part in how much water the body will keep or how much water the body will excrete. Urea is initially reabsorbed and later secreted back into the tubules. Nitrogenous waste, such as urea, diffuses through the renal tubules with water. What is secreted during tubular secretion? Waste removal such as uric acid, ammonia, urea, creatinine, and bile acids. Tubular secretion of bicarbonate ions and hydrogen serves to regulate the pH of the body's fluids. Where does urine end up? So once the tubular fluid has left the renal tubules, it proceeds on to the collecting ducts. At this point, the tubular fluid is now urine. The collecting ducts continues to concentrate the urine. Urine continues to make its way through the kidneys, minor and major calyxes, to the renal pelvis, where it leaves the kidneys. The ureter takes the urine to the bladder. From the bladder, urine travels through the urethra to be excreted from the body. Now let's talk about the anatomy and physiologic changes with nephro and urolithiasis. So urolithiasis is the presence of calculi anywhere in the urinary tract. It includes nephrolithiasis, which are renal stones, uretolithiasis, which are stones in the ureter, and cystolithiasis, which are stones in the bladder. Our nephrolithiasis are known as kidney stones. It is one or more solid masses made of crystals. Calcium oxalate stones are the most common. Our struvite stones are found in women with UTIs, and that's urinary tract infections. Uric acid stones are found in patients with gout. Symptoms of a nephro or urolithiasis include pain in the abdomen, flank, groin, or testes, abnormal urine color, hematuria, chills or fever, nausea, and vomiting. Diagnosis and treatment includes abdominal CT, MRI, X-rays, kidney ultrasound, kidney function test, urinalysis for presence of crystals or blood. Treatment includes small stones generally pass on their own, lithotripsy to remove stones smaller than ½ inch, percutaneous nephrolithotomy for large stones. Patients with severe pain may require narcotics. Complications is a loss of function in the affected kidney, obstruction of the ureter, urinary tract infection. Benign prostatic hypertrophy is the enlarged prostate that is not cancerous and does not increase risk of developing prostate cancer. Incidence increases with age. Cause is unknown. BPH in urine flow. So the male urethra passes through the prostate gland. Enlarged prostate puts pressure on the urethra and disrupts the urine flow. Difficulty starting urination, nocturia, weak stream, and several symptoms follow. Urine flow and anticholinergic drugs cause urinary retention by decreasing contractions of the detrusor muscle, which is necessary to empty the bladder. And that's all. Thank you for listening.